This is Dr. Karthika from Department of Biomedical Engineering, SNS College of Technology, Coimbatore. Today, our students of second year Biomedical Engineering are going to discuss a case study on a remote patient monitoring system using IoT sensors. And we know that our aim is to get a clear, accurate data for patient monitoring. Here, our block diagram which involves sensors. First thing are sensors which sense biosignals or environmental information. For our biomedical applications, we use our human body as a element. From this, we can sense our physiological signals and physiological elements. From sensors to transducers. Sensors, it sends the signals and that information is fed into transducer. Transducer converts our sensing signal into an electrical signal. After that, if we need some amplification means we get that signal into our amplification part, that is our signal conditioning unit, and finally we will get a proper amplified signal. Here the main thing is this in between. From transmitter to receiver side we need some networks. In biology, in our biosignals, we use body area networks. With the help of body area network, we can transmit data from one end to another end. For transmission and reception purpose, we use antennas. Based on applications, we prefer special kind of antennas for transmit and receive signals through our human body. Shall we start?
Hello everyone, myself Haranya. Today we are presenting case study of remote patient monitoring sensor system using IoT sensors. And RPM is a healthcare device which is very useful for the doctors from distant to diagnosis the patient from diabetes and heart attacks and some other many hypertension diseases. And this IoT sensors which helps to connect the doctors from distant patients and to collect the data and store the data for many years. And this RPM system have many advantages and disadvantages, and we are gonna see the case study on many advantages of this RPM system.
Now let me explain the problem statement. In many rural and remote areas, the access to healthcare is very limited. Patient needs to travel long distances for regular health checkups. This leads to delay in diagnosis and increased healthcare costs, and also leads to some serious complications. For example, consider a patient with heart disease. Continuous monitoring is required, but frequent hospital visits are not always possible. So there is a need for a system where we can monitor the patient continuously and get alert to the doctors if anything abnormality is visible. So here comes our IoT-based remote monitoring system, which is very useful.
So now let's discuss about the solution. Our solution is IoT-based remote patient monitoring system. So in this solution, the sensor is attached to the patient's body, which checks the vital parameters like heart rate, blood pressure, body temperature, and oxygen saturation. So the sensor is connected to the microcontroller like Arduino, and the collected data is transmitted through the internet to the cloud platform. So the collected data is directly the doctors can access through the mobile app. So if any abnormal value is detected, it sends alert to both patients and doctors.
Good. Can anyone explain the system architecture?
Sure, ma'am. Okay. Let me explain system architecture and working. So first of all, our system consists of four main important layers. And the first one was sensor layer, which is used to collect the patient's data. And the next one, microcontroller, which is used to process the collected data. And the third one, communication layer. With the help of communication layer, we can simply process the data via Bluetooth or Wi-Fi. And the fourth main layer was cloud or data storage layer. And the collected data was stored there. So let me explain the working. So first of all, as I spoke earlier, sensors collect the patient's data, and the collected data sends to microcontroller for further processing, and the processed data was sent to was stored to the cloud with the help of microcontroller, and it was sent by Bluetooth and Wi-Fi. So doctor can monitor the patients remotely, and alerts were generated abnormal conditions were occurred. So this ensures the patient health without visiting the hospital frequently. So that's all about the working process.
So, hello everyone, I am here to explain the real example for our case study. So, consider a 60 years old man have a high stress and hypertension. He live in a rural area. So, he won't get wearable IoT based wearable in their hand. So, sometimes they have an abnormality heart rate. The IoT based wearable can detect that heart rate, and the device can transfer that data into the hospital doctor. So the doctor can see that data in their mobile app. So they can change their medications and can give some instruction to that patient to help their abnormalities heart rate. So this can avoid that heart attack in the rural areas.
As coming to the end of the case study, I am Balaji. I am going to explain the advantages, challenges, and the conclusion of the case study. Advantages of this IoT-based remote patient monitoring systems are it continuously monitors the patient's health, and it can reduce the cost effectiveness, and early disease prediction is possible. It reduces the frequent hospital visits, and the main challenges includes data security issues and internet connectivity. It needs a prolonged internet connectivity to function, so it is not possible in all certain cases and all. As a conclusion, this is a very booming technology, and it could play a very vital role in future.